undeniably, the greatest aspect of the society, most rewarding, most fulfilling, is the intense volunteerism and commitment by the members.
This next procedure we'll be doing is a Lefort-1 osteotomy. We'll be doing a segmental osteotomy with a 4-tooth anterior segment. We'll be doing interdental osteotomies between the canine and lateral incisor teeth. And we'll be demonstrating then the method of reducing bony interferences and then rigidly fixating all of the segments.
I conduct all the balloting, collate all the results, and report those results to the Secretariat, which is the Laser Institute of America. I maintain membership rosters and communications links with all the members of the ANSI standards. I maintain the content agenda, which is actually the table of contents of the work that we do throughout the year on the revision of the standards.
The footage from today's procedure will be well understood by an experienced surgeon. It begins actually once we've removed some cartilage when we're beginning under the microscope. There is roughly an hour and a half or 2 hours of work that's gone on before we use a drill, for example, with atresia surgery.
As a GI interventionalist, what we see and do each and every day is diagnose and treat precancerous lesions, early cancer in the GI tract.
And so we're not concerned about either some bleeding around the periphery or the need for irrigating the wound at the end. And as a result, we have a fat setting product that is a firm seal and has been able to maintain the success rates in terms of preventing CSF leak, but also give us that added security that we're not concerned about the moist environment.
This case is a total hip replacement in a patient who's 73 years old, has had right hip pain for several years, is a manual laborer, works in a machine shop, and has failed corticosteroid injections, anti-inflammatory medication, and physical therapy.
We're going to begin the demonstration with a sagittal osteotomy. This is usually done in a bilateral fashion, but for demonstration purposes today we'll be doing this on the right side and securing the segments with 3 screws for rigid fixation.
The patient we are operating on today is a 54-year-old female with a 3 to 6 month history of severe neck pain with radicular pain and some early signs of myelopathic symptoms.
I think my advice for young orthopedic physicians would be threefold. I think the first is become very good at your craft and take good care of your patients. So that's number one.
The big benefit to using the laser is the short-term recovery. Patients have less bleeding and bruising, can get back to work sooner. Many of my patients will actually go to work within 2 or 3 days after having this procedure done.
Typically, patients come to me from the radiation oncology department or medical oncology department with metastatic spinal lesions, sometimes with fractures, but they all share one thing in common. They're all experiencing significant pain.
The normal or the routine consultation with patients has been a verbal description of what a patient might expect from a hair restoration surgery. We try to describe it in terms of density and how it might look 10 months after the procedure, but it's very difficult to describe that to a patient.
So the options that most patients have classically been offered when they've been giving the diagnosis of cancer that's spread to their spine have been oral symptom control, such as narcotics or pain medications to alleviate the pain, basically trying to live with the pain and mask the pain with oral pain medications.